Hello, everybody. Welcome back to another off the beaten path normal episode of Dadcast. I'm your host, JP, joining as always, co-host Mr. Nick Martin. Hello, Nick.
Hey, what's up?
I'm just hanging out, man. We are joined by our very special guest, Dr. Phillips, in part. Oh, hello, doctor.
Hello. Thanks for having me today.
You're very welcome. This episode is, I guess, a part 3 to our ongoing a Dadcast investigation into COVID and everything going on here in our community. And with that being said, Mr. Nick Martin, I hand off the conch to you.
All right. So we'll do this just a little bit different. I'm just going to ask questions and we'll get the answers. I'm sorry. First of all, Dr. Phillips is a pediatrician at Grants Pass Clinic, Josephine County here in Southern Oregon. So for anyone wondering if he is knowledgeable, and yeah, I would say so. Right, Nick? Yes, very knowledgeable. Like
Some days.
He's actually my baby's pediatrician. So yeah.
You can say that, I can't. So
yeah. Okay. So how big of a crisis are we going through in your opinion?
Well, I mean, if I look out my window, I see smoke from forest fires, and I think this Delta variant could be compared to a forest fire that's just burning through our population. We are the fuel, and it seems to be finding lots and lots to burn.
So in your opinion, any truth to what we're seeing on media and from what I've heard from different guests across the country that Josephine County, Jackson County is two of the worst counties in the country?
Well, we're right up there. I mean, our hospital is busting at the seams. We're comparable to many of the other areas that are just really struggling right now.
Okay.
Is there any truth to the I've seen this again, I don't know if it's valid in any form or fashion, but is there any truth to the statement that if there's fewer nurses able to attend a bed, therefore there are less beds in the hospital? So by reporting beds are full, it's only because there's only less workers to take care of them?
I guess you could, that's an argument that could be made. All I know is if it were possible for our, anybody to walk through our hospital, they would see that I think our hospital at full capacity when it was designed for like 125 people, and we have 145 people there. They're being managed by somebody, right?
Right.
And so, we are just full to overflowing. Even the family birth center where mothers come in to give birth, the back hallway is being co-opted by adult patients. The PACU, which is if you have an operation and then you're done, you go into the PACU to get stabilized before going back to your bed. That's been co-opted and is now patient beds. And the ER has, patients on gurneys. All the different floors are full. So, we're overflowing. So somebody is seeing these patients.
All right. So when we talked to County Commissioner Bercheiger, we asked him, should we have accepted more money from the state to promote the vaccine? And he told us no, because they've already accepted the money and they're not spending it. Do you think they should accept the rest of the money that was offered from the state for COVID situations to open up an offsite hospital, promote the vaccine more so than they are set up an offsite vaccine thing like they do in Jackson County at the fairgrounds for the weekends? Would that help?
I think if we had the money, I think that we would find ways to use it to help our population. Obviously I disagree with the concept that we have it and we're not spending it. We should be spending it. We should take everything that's offered to get the message out and just really, when my personal opinion, if you're elected, sometimes you have to make hard choices and you should be protecting all of the population.
Mm-hmm.
What would you say to the population that make the statement, I'm not getting the vaccine, I don't need the vaccine, it does not work, et cetera, et cetera?
and this is very difficult. The vaccines are, scientifically proven. They're very effective and they're very safe. It's just, it's hard to get that message out consistently because there's just so much, there's a whole industry that's been generated around sowing doubt and dissension, and it's unfortunate.
Mm-hmm.
These vaccines have been developed. They've been given billions with a B, billions of times around the world. They're very safe. They're very effective. We know that just because of our hospitalization rates are, 93% of those in the hospital with COVID are unvaccinated. This pandemic has now become a pandemic primarily of the unvaccinated. The thing speaks for itself.
Mm-hmm. So along that same question, I've been doing a lot of research and found that the COVID vaccine isn't like a brand new vaccine. It's something that's been worked on for years because we've had a form of COVID many years ago that didn't become crazy and bad like this is. So it's really not a new vaccine. It's just they've perfected it to combat this variant of COVID.
I would probably tweak that a little bit and just say the technology that's being used, the mRNA technology that's in the Pfizer and Moderna vaccines is not new technology. It's been around for years and years and used in other purposes for other purposes. And it's a ideal vaccine module or vaccine method. And this is the first large scale vaccine that's been developed using that. However, the technology has been used for years and years, and it has been determined to be very safe and with this vaccine, it's very effective.
Mm. What would you say to and again I can't validate this next statement in question, something I read, but I've heard that locally there are a growing list of doctors who are against getting the vaccine. Is there any truth to that? And if it is, why?
I'm not aware of, locally, I think most of our physicians are pretty much on board that these are very effective and very safe vaccines. Let's be honest, there are different vaccines, right? So if you have a problem with the mRNA vaccine, get the Johnson & Johnson. There's Novavax is coming out shortly, and that's just tried and true, technology that's been around for, decades. So, a blanket statement that I won't get any vaccine at all, doesn't, to me, it could be, if you have a problem with one, why not just consider another? Yeah. Everything helps.
Let's see. Sorry, I'm trying to read the questions here. So let's talk about schools. How safe do you think schools are with considering everything that I've read? I think it's like 85-90% right now of schools that have opened this school year have had some sort of an outbreak, whether it's 2-3 cases, if not more. Cascade Christian just had an outbreak, their entire football team. So
yeah. I think what we have to do is we have to break this pandemic down. Last year, I would have probably agreed that, we should probably be, we were being overly cautious by closing everything down. The original COVID variant did not impact children to the same degree it did adults, especially older adults. This Delta variant has thrown all of that out the window. It's just so much more contagious. And with, if it's that much more contagious, then you have that many more people getting sick, and everything just flows from there. More people being sick means a small percent of those will go into the hospital. And of those, a smaller percent will die. But when you're talking bigger and bigger numbers with this Delta variant, we're even seeing it taking off in schools, in kids. And we're seeing, even our own state facilities for children are just very full. And we're seeing I had a patient of mine that was up in Portland in the ICU, because of COVID related illness. And so we are going to see that more and more. As you get more cases, you get more complications, and you get more hospitalizations. And, it's just everything flows. It's all numbers.
Mm-hmm. So do you think it would be a good idea for the county commissioners to authorize opening an offsite hospital to take out the patients that can't leave the hospital yet, but aren't emergency patients, to free up some emergency beds and kind of increase the flow a little bit, I guess?
I think we should do whatever we can. That's kind of above my pay grade. I've heard that we have nurses that are being, brought into our area. Again, if you open an offsite facility, if we're just barely hanging on with our own facility and we open somewhere else and we can't staff it, then we're back to that same question you brought up earlier. Mm-hmm. I've heard that they're bringing in a whole bunch of nurses and other professionals in. If we could, and then we should have, let the people who do this for a living, they're much smarter than I am as far as like determining what is the best approach to getting this process under control, getting people out of the hospital, even if they have to go to an offsite because they're not ready to go home yet, but they're not sick enough to really be an extended stay in the hospital. There's lots of people thinking about this, and it's keeping them awake every single night. I'm in an outpatient clinic. We have different struggles here, but mm-hmm. I just think that we should be taking all the help that we can, because, I think the take-home message today is all these numbers we're hearing, hospitalizations, deaths. These are real people. These are, husbands and wives. These are brothers and sisters and cousins and coworkers. These are real people. And even one death is a tragedy. But I have last week's paper, there was a section of time where we had 28 deaths in 7 days. That's every 6 hours. One of our local population was passing away from COVID.
Yeah, from talking to one of the guests that we had on episode 2 of this series that we're doing, he was saying typically we get, maybe 3 or 4 deaths a day from the hospital, not 7 or 8 like we're seeing right now. So is that true?
I'll take their word for it. I'm not, obviously in pediatrics, death is very rare, fortunately.
Yeah.
But there are, we are in a retirement community, so death is a part of life, and we would see that. But if you look into excess deaths, that's been the whole thing about trying to get a real handle on the numbers since COVID started. Is you look at excess deaths, how many deaths. Our hospital system, our healthcare system, everything is set up on a routine. We know for this amount of population, we have a 125 bed hospital in Grants Pass, Oregon, because we knew that we're never operating at capacity. We know that we can we should expect this many patients in at a given time. It varies by the time of the year, and we have this many surgeries, and that we should anticipate this many, appendix surgeries and knees, and we're just overwhelmed. And so one way they can evaluate this pandemic is they can look at excess deaths, right? How many were we expecting this month, and how many did we get? And, if anything, the 600,000 to 700,000 Americans that have died is an underestimate. Mm-hmm. It's just,
I was bringing up the fact of we should have canceled the Josephine County Fair with the county commissioner based off the Jackson County numbers of 70,000 people in attendance, 1,500 immediately testing positive. There's probably 5,000 or 6,000 people that didn't even go get tested that had COVID.
Yeah, that's
so it's just the whole thing is crazy. I'm going to talk a little bit about the Ivermectin, if you're okay with that. It's Joe. I want to get a medical professional's opinion on Joe Rogan.
For human
consumption. Joe Rogan made a big post. It got blown out of proportion. If you watch the entire episode, he says he got his doctor to prescribe it, the human version of it. Everything in the media said he went to the Grange and got it for his horse. And so there is a difference, right, between what doctors prescribe for humans and what you can go to the Grange and get.
Yeah, absolutely. Absolutely. And that's why, the poison control numbers are, spiking through the ceiling, because people are, taking doses and dosing regimens that are not designed for human bodies. They're designed for large animals, or, it's hard to fathom. I have friends who approached me about, prescribing ivermectin. I don't know enough about it. What I do know, as I've looked into it a little bit, is that any benefits that have been out there are in vitro, which means in a petri dish. Mm-hmm. And there haven't been any in vivo or in a human body studies that have shown any real benefit. So it's not worth the risk of taking it, even in human doses. There doesn't appear to be, there at this point, there's not enough data to show that for humans that it has any protective or palliative effect, on COVID. Mm-hmm. Now that may change over time. There are lots of people studying this, but as of right now, we just don't have the data. And that's the whole thing with this COVID. It just seems like it's outrage after outrage after outrage. Masks, not this, do this, not that. In science, we incorporate new information. So as you get new information, you change things, right? And so like for babies, back when I was growing up, it was put the baby on their tummy and they'll sleep better. Well, now we've learned that, you have babies sleep on their back and the rate of SIDS, or sudden infant death, is much lower, right? So, a lot of as we gain new information, we change our ideas. So we may end up changing our ideas on ivermectin, but please don't experiment on yourself.
And what blows my mind is there are people out there who will not get the vaccine. I do not know what's in it. There's not enough information. But you are going to go ahead and get prescribed a horse medicine, for lack of a better way to put it, that has, 99% less science behind it at this point, and that's fine. It
is mind-blowing. Yes.
I can't put it any better way. Well, and I know a couple people locally too. I won't mention names, and I'm not. And that person, I was actually very smart in the post that was put regarding it. He wasn't, or she wasn't, super negative. He just put out facts of what this person did while taking it, and got the human version, it's a lower dose, along with another cocktail of other things. And so far, so good. But how do we know if this person didn't take any of that and just had a real good immune system and wasn't affected as bad without it? Again, the science isn't there. The stats have not been done. The studies haven't been done enough on that topic for it to even be relevant in my mind. But what do I know? I'm just a podcaster, radio DJ guy.
That's right. I'm just a concerned dad that watches Joe Rogan.
I have a question, because you are a pediatrician. Have you seen very many cases of children being infected? And if so, how were the symptoms with them?
We've routinely had positive cases in our pediatric population. We test, right here at our clinic, and we only test if they're symptomatic, and probably 30 to 50% have been positive. There are, other illnesses that still circulate, other viruses and different things. But if we test a child because they have, nasal symptoms, cough, they're tired, even GI stuff for pediatrics, we're getting a significant number that are still positive.
And how has it affected them?
Most of the time, they do fine. And let's be honest, most of the time, the general population does fine. It's hard to predict which ones will escalate and be more serious, especially, those of us older folks that are getting longer in the tooth. We just don't know which, who's going to get hit worse. And, So it happens even in kids. And like I said, I had a patient up in the intensive care unit in Portland, due to COVID. So I just, we shouldn't be rolling the dice with our lives.
Has there been any updates or news as far as the progression of allowing younger children to get a vaccine, the vaccine, or a variant thereof?
Yeah. So the next step will be school age. So 5 through 11. It's approved for 12 and up right now. 5 through 11 is the next. It'll probably be later in the fall into winter. I think they do this in a very stepwise approach, and I think they actually added more children to the pool of data so that they could crunch more numbers and make sure that they are feeling really confident. It'll most likely be a different dose than we give to adults, and there might even be a different dosing frequency.
Mm-hmm. Would you be willing to make a statement to encourage people to stay home, stay safe over the next 3 weeks to slow down the spread of what we've got going?
Yes, like he said.
All right.
There was the statement. Yes.
Yes.
Yeah. My biggest fear is like my kids go to school. What if, somebody falls down and breaks a leg? Right now, my understanding is it's anywhere from a 12 to 15 hour wait at the emergency room. Yeah. Unless it's like a life or death situation.
Yeah. And actually even life or death, unfortunately, it may not matter because the person there with COVID might be struggling with life or death. And so there was an article in the paper recently about one of our local physicians who had retired from the ER, sat in our ER after having a heart attack. They couldn't get him to the help that he needed for I think it was 8 or 12 hours. And fortunately he did okay. But I mean, if anybody could be fast tracked through the ER, you think it would be a retired ER physician. And it was just so bogged down. And, there are people who are, waiting on cancer surgery, who all elective surgeries have been canceled right now because we just don't have the staff or the space.
Crazy times we're living in.
Yeah.
Got any more, Nick?
I know that's all the questions. So basically just stay safe, be responsible, be respectful.
And I'd like to add anyone who might feel like arguing against any of what has been discussed on this episode, that this is a certified doctor.
Or certifiable.
Don't tell them that. We're not just grabbing Joe Schmo off the street and asking him questions. This man is living it. He is in it. And it would be unwise to take the words and just throw them away. Just saying.
What I would like to mention is I spoke, one of my moms today in clinic is an ER nurse, and my sister is an ICU nurse out of state in another state that's just blowing up. And this is exhausting. If you can think about your job, if you had 12-hour days where people are incredibly sick and you're just running around with your hair on fire day in, day out, down in the trenches. I wish there was a way with HIPAA. There was a way that.
Uh-oh.
Did I lose you?
We lost your video and your audio is super low.
Something happened. Unmute my audio. Hey. Is that better?
Nope. Still pretty.
Changed my input, unfortunately.
So whatever microphone is picking up now, if you can just get closer to it. We're really near the end of this thing anyway, so it's not super duper important to get the video back, but
yeah.
Oh, party people, as with all technology, sometimes things happen.
Anyway, I just like to encourage everybody to be kind. There's so much just dissension and division lately. Let's just be kind. Realize that people are people, even the nurses and the doctors. Everybody's trying to do their best, and And this pandemic has been trying on us all.
Absolutely. And again, you can disagree with all this wholeheartedly, and that's fine, man. That is your right. You can agree with us wholeheartedly. That is your right too. But just because you disagree does not mean you need to be a jerk to your fellow people out there, man.
We're just trying to get the info out for you. And that's it.
All right. Dr. Phillips, I want to thank you very much for taking time to come on Dadcast to discuss these issues. We very, very much appreciate it.
Thanks for having me.
Yeah, thank you.
And everyone else, again, I promise more lighthearted Dadcast conversations are coming up very, very soon. So go ahead and subscribe to the channel, like it up, leave a comment, whichever way you go, and we'll see you on the next episode, whenever that may be. Have a great rest of your day. Again, Dr. Phillips, thank you very much. Nick, thank you. And we'll see y'all soon.
Yeah.